patient care and medical research while driving economic growth. We offer particular thanks to those leaders, again, many of you are here, who engaged in this process with us, for your candor, your insights, and for your passion for your own missions, which the IMD is here to support. I'd like to now introduce Dr. Michelle Russell, the lead partner for the Midwest region and Canadian health science practice of BCG. Michelle herself played a key role in our strategic planning process. Many of you have already met her because she was part of that wonderful audit interview process that we underwent early on in their engagement. And Michelle, among other things, holds a PhD herself in organic chemistry from Stanford. On a personal note, I just must say, I'm compelled to say, that I have never worked in my decades-long career with any more incredibly talented consulting group. The critical thinkers that they brought to this work was just transformative, so I thank you. They were and remain an essential part of our team. Michelle?
Thank you, Madam President. It is an absolute pleasure to represent the team that supported you from the Boston Consulting Group. Myself, Dan Grossman, Barry Rosenberg, Dave Matheson, who is here as well from Boston, and Sandeep Bidari, who led the effort amazingly. We could not have done this without the engagement of yourself. Mr. Ribley, Warren, you were amazing and continue to be, both in your partnership on this and the execution that you have led subsequent to actually drafting the strategic plan. But I'm getting ahead of myself. So as we talk about the strategic planning and what we did, we started actually with limited knowledge of the Illinois Medical District. And as we got to know the district, we were astonished by the richness of the resources that I think, Madam President, you've talked about on many occasions, and the opportunities within the district, within the hospitals and the universities that are part of this, the medical research facilities, the labs, and the more than 40 healthcare-related facilities that are among the partners. As we engaged the stakeholders in over 40 interviews, we were also amazed and pleased with their candor and with their commitment to Chicago, to the state, and to bettering the lives of patients and their employees. And through that, we actually were able to get great alignment around the strategic plan and the areas of focus that we'll talk about. We also, as you alluded to, brought perspectives from benchmarking of other cutting-edge medical districts and health districts throughout the country, both to identify best practices, but also potentially avoid mistakes that others had made. And so through that work, we actually identified 4 key areas that we believe can be priorities for the district's vision and where we can be a leader in patient care and medical research, driving economic growth. Those 4 areas are first and foremost infrastructure and development. This is optimizing the use of the district property and improving the experience for employees, patients, and partners. There was resounding alignment from all of the stakeholders that we spoke to. This is the logical starting point for the district commission. This is your initial focus. However, there was great engagement and enthusiasm to actually go beyond the focus on infrastructure to focus on 3 other areas. The first of which is community health, improving healthcare access and reducing the cost of care through focus on chronic diseases. A second area of focus is around translational research, supporting the translation of research from biomedical discovery to patient care, and the subsequent commercialization of that research that can lead and drive economic growth. The third area is clinical data, which is facilitating the sharing of healthcare data to improve patient care, patient service, hospital resource effectiveness, and cost efficiency. Those 4 areas also align nicely with the priorities of the state, which include high-speed internet, creating an environment that is conducive to job growth, enhancing the economic well-being of residents and communities, improving access to and cost effectiveness of healthcare, and advancing health information exchange. So through the course of all of those interviews, through the benchmarking, we actually identified 64 initiatives that fall within those 4 pillars of focus. And we prioritized those through engaging the Strategic Advisory Committee, through engaging the commissioners, through engaging the partners who are part of the district, and prioritized a set of 12 initiatives that became the strategic plan. Within the impact of that plan is several thousand jobs created, greater economic activity, greater research innovation, and better health outcomes for the district. This will drive a growth for the district over the next 10 years. We put in place as well a very tactical plan for how do you go about this in 2013. Per the recommendation of both the advisory committee as well as Madam President and the executive director, we were not shy in putting together a very ambitious plan, and it thrills me beyond belief to actually say that the commission and the executive director have exceeded the pace of that plan and are making enormous progress in a very short time period. I don't know in my over 10 years with BCG that I've ever seen, particularly in a public-private partnership and the nature of the work that we were doing, so much momentum created so quickly. If you think about sort of completing the strategic plan towards the tail end of last year, what you've accomplished in this first quarter, you should be very proud of. And actually, I believe, Warren, you're going to share some of the highlights of the progress that you've made in driving that strategic plan. So thrilled with the progress you've made and excited to see the journey and the progress for the entire district going forward over the next 10 years.
Michelle, thank you so much.
Thank you, Madam President. Thank you, Michelle. So today you've heard what our new strategic vision is. You've learned about the 4 pillars, 4 themes around which our activity is guided. I'm going to talk in a bit more detail about some of the substantive projects and initiatives that are underway that support each of those 4 themes. Before getting into that, though,